I also, before we get into the overall objectives, just want to thank the partners and funders who have been part of this work. So thank you so much to Dartmouth Health, to New Hampshire Charitable Foundation, Couch Family Foundation, and to our legal partner, New Hampshire Legal Assistance. Next slide, please. So a little bit about me. Thanks, Becca, for the introduction. I have been working in the fields of early childhood, community impact, community nonprofit, and healthcare for basically my entire educational and professional career, starting really in early childhood settings and then making my way into community settings and then healthcare. Doing direct service work and then more quality improvement research and then project implementation. Currently, there's several projects that I lead, and they all really fall into the scope of improving our communities and improving population level health, really focused on children and families, on communities, really focused on mental health and trauma impacted. So enough about me. Let's move into the presentation. The objectives for today. Just go back one more, Alyssa, for me. Sorry about that. Alyssa and I are going to tag team today because we are going to make this pretty interactive for you all. I got a little nervous knowing that it was a Friday afternoon presentation and then realized I actually wasn't the last presenter today. So I'm going to save the jumping jacks and yoga poses for the next presenters, and we're going to make this fairly interactive. So I hope everyone had a cup of coffee after their lunch and get ready to dive in with us. So our objectives today are to understand social impacts on health and the role for legal supports and services as an upstream method for prevention and intervention. Components and development of a medical legal partnership. This is newer in the field. Some of you might be familiar, but we're going to talk a little bit about an MLP and then a little bit about sort of partnering across sectors, and then strategies and concepts in developing cross-system collaboration for improved health outcomes. And my hope is that this session, you carry forward what you've sort of already been engaged with today, your previous work and your current work, and be thinking about sort of how we shape and move things into the future. Next slide, please. So what determines our health? Some of you might have seen a slide like this before, but just take a minute to take a look at these three photos. And what I'd like us to do is in the chat, just in a word or a couple of words, what are you seeing across these photos that could or may drive an individual's health? What are some of the pieces that really stick out to you? And just pop those into the chat. Size of the home, great. Water and sanitation, complete extremes, overall environment, disparities in wealth, great. Different degrees of protection from weather, SDOH infrastructure, closeness to others, isolation. Noise level, weather and health equity. Other groups have said, concrete pieces too, like food access, access to healthcare, jobs, trash disposal, access to transportation, sanitation inequity. Ooh, differences in baseline stress level, which we know impact health. Great. Next slide, Alyssa. Thanks, everyone. So this graphic is probably familiar to some of you. It comes from the county health rankings and roadmaps, originally defined by the WHO, which is the conditions on where people are born, where they live, grow, work, and age. Think back to those three pictures right there. And now we have the various distribution of money, power, resources, alongside access and quality of healthcare. So some of you picked up on that. Wealth, the access to resources. Well, we won't spend a lot of time going into further detail about SDOHs and how that intersects with the healthcare system, the take-home point for this is that it does exist, that we understand the impact it plays on individual health. And what we will discuss moving forward are what the impact of a civil legal components are that are aligned with health outcomes, and how can that be a point of intervention for improving one's health. I'm going to throw a few stats out at you and just let it sit with you for a minute. Many of these came from, and I'm going to show a slide for the Justice Gap survey that was done. 55%, so 1 in 2 low-income Americans who personally experience a problem say that these problems substantially impact their lives, with consequences affecting their finances, mental health, physical health and safety, and relationships. And again, problems are related to health. 74%, 3 in 4 individuals of low-income households experience 1+ civil legal problem in the past year. 40%, 2 in 5 individuals experience 5+ problems. And 20% experience 10+ problems. Those are a lot of challenges that can be and are most likely impacting someone's health. So if you think of the gray and the blue columns, 5+ and 10+, which we know impact directly because of this graphic here, length of life and quality of life. Most common types of problems, quote unquote, are consumer issues, healthcare issues, housing, income maintenance. And to top this, more than 50% that were surveyed felt that they could not afford a lawyer for some of these issues that required legal intervention. Of note, people with higher incomes, which you noted in those photos just before this slide, are more likely to seek legal support because they have the finances, they have the resources, so they're able to access that. Next slide, please. Here's a graphic from the Social Innovations Journal that a recent research article from the New England Journal of Medicine estimates that 60% of an individual's health is determined by environmental and social determinants, social drivers, while only 40% of health is influenced by medical care and genetics. So 60% are impacted by what's falling into these shades of green here. Many of the social drivers of health are legal problems or have legal implication. Apartments with code violations, domestic violence, lack of adequate income or food. The American Bar Association reported that every low-income individual in the United States currently faces 2 to 3 health-harming legal needs. However, only 20% of low-income people with such legal problems or challenges obtain the assistance that they need. Next slide. So on the left, you're going to see barriers to justice. Again, think back to that real concrete picture, that slide that showed 3 pictures. Barriers of access, understanding, access to supports, multi-level struggles. So when things just keep getting stacked on top, judgment, stigma, and fear of the judicial system, of a power differential, contraindications of policies. We just heard in our last presenter about the policy change that's happening, that is needed, and then cost. Insert the use of an MLP, and we move towards improved outcomes. Someone mentioned reducing stress. When we are able to implement a resource or a support that has action, it reduces stress, improved well-being, increased compliance, better use of healthcare resources, better financial security, reduced healthcare utilization, and improved quality of life. Evaluations of MLPs have shown that healthcare providers and lawyers working together, a multi-sector partnership, can advance health equity for vulnerable communities, residents, and improve their health outcomes. By addressing upstream systematic legal and social issues that affect population health, MLPs can also result in policy change. In fact, experts suggest that screening patients for legal issues become a standard practice in clinical care. Next slide, please. This is the slide I was telling you about, that there was a large survey done, the Justice Survey Gap. And this was created by the Legal Services Corporation. They completed 4 in total, the most recent one in 2017, and then a more recent one in 2021. This comprehensive survey is that out of 5,000 households across the US, 2,000 under 125% of the federal poverty level and 3,000 above. The above slide demonstrates that about 3/4 of the population did not seek legal help for problems with impact. Again, this relates to what we discussed in the previous slides around barriers that low-income families experience. There's a lot more that was included to take a look at in the 2021 Justice Gap survey. So I'd encourage you to take a look at that. It is cited in the references at the end of this presentation that you'll have access to. And it really talks about the impacts of populations that you probably support in your day-to-day work. Next slide. So I've given you a little bit of a background about why an MLP is important, why social drivers impact our health, and the need for civil legal impact alongside of that. So what is an MLP? For those of you who might not be familiar, it's very much what this graphic shows. It's a model of integrating medical and legal care to address legal and social issues that contribute to poor health outcomes. MLPs vary in the population that they serve and support and address a variety of issues that affect health, including public benefits, education, employment, immigration, housing, and personal safety, but not limited to those categories. They also vary in their strategies and approaches. In some cases, a lawyer might be embedded in a healthcare setting. In other cases, legal aid is obtained through a partnership between the healthcare clinic and existing legal service organizations. Overall, there's a mix between legal aid support, healthcare, health needs of a population, education of both clients and staff, resources and supports, and advocacy at a policy level. According to the National Center for MLPs, as of January 2019, there are over 333 health organizations that are holding MLPs across 46 states. To show you a little bit more about the impact of what an MLP can do, we're going to show you a video. This is taken from UMass Memorial in Worcester, Massachusetts, from the STRIDE program. And Alyssa's going to pull that up for us.
And do you know if it has closed captioning?
I do not. I do not believe so.
I can look here. It doesn't. Let's see. I don't see closed captioning. Sorry.
Thank you. No worries.
You're welcome. Can everyone see the screen?
We can.
Great.
I was at my primary care doctor, and I talked to him about my situation, and he asked me that I wanted to speak with a doctor and a psychiatrist, and I accepted. And she did some legwork, and she led me here to community legal aid. I got my rent adjusted, and I got a housing voucher through Section 8, all from Lincoln Community Legal Aid. She even went with me to my interview at housing. She went above and beyond, to be honest. And I know a lot of people out there probably was in my same situation. They don't even know how to get information like I got. I feel like I was blessed because it actually saved my life, to be honest. I don't know what I really don't know what I don't want to be homeless like that.
Trying to get him into a school that would actually give him the best that he needs was very difficult, doing it on my own and with advocates. and I had no one else to turn to. A lot of attorneys did not do cases like this anymore. So I did contact my caseworker with UMass, let her know the situation, and she helped me out with that. And the process was pretty quick. Just fill out forms with my information, fax it over or hand it over to them, and they reviewed the case and said they were able to do it, and we got the ball rolling. My son is in a new placement in a new school. He's actually in one of the best autism classrooms in Worcester. Yeah, it was rated #1, and he is doing amazing. The staff is great. The classroom is structured. It provides everything that he needs to actually function and learn.
Everybody was like a family to me. They were like a family to me. They were very helpful. They were able to guide me through everything that I needed to do. And even at the courthouse, she was there present with me. When I was nervous at the courthouse, she was like, "Calm down, everything will be okay." And I needed that support. And that support I was able to get from community legal aid. I mean, that's the best thing that ever happened to me. I really like the experience I had with them, and I would do it again if I had to.
I was having problems getting housing because of my query. And plus I wanted to clear my query since I've been out of trouble for like 13 years already. And I've been continuing to do that. She sent away for the query and sent me, showed me the old one, and she had to send away for it in Boston or something, and I got the original query, which was blank. There's no arrest, so that proved that it was sealed. And I was like, what? I had a 27-page query. So that's pretty bad. That's how terrible I was, and ignorant and dumb, and just ignorant and dumb, you know what I mean? And crime doesn't pay, you know what I mean? It was time for a change, and I was determined to, I got tired of going back to jail, in and out. It was a cycle for me. Every 6 months to a year, I would go to prison and do a stretch. So it was just time to just do the right thing. It took a process, it took some time, but I'm finally glad I got it over with though. So having the query sealed, that helped out even more, you know what I'm saying? So she helped us out. We had a lot of people helping us out tremendously, because that was blocking us, my query.
Thanks, Alyssa, for popping that up. So we're going to run a little activity.
Welcome.
We're going to run an Oh, go ahead. Really impactful. I always wish when I'm doing project implementation that I can pop folks
Many of our
into...
patients have never had someone advocate for them before. And all they have done is hit walls and
Oh, Alyssa, I think
We can hear the
try
video,
to
Alyssa.
advocate.
There we go. All right. So as I was saying, in much of the work that I do, I always want to pop audiences into the clinic walls or the program walls so that you can see firsthand. And we're fairly new with our MLP, and so we haven't done any of this video recording at this point. So I hope everyone found some of those client stories really helpful in helping to sort of connect the dots around what an MLP is and can do. We're going to run a little activity right now in response to the video. And so what Alyssa has just done is she popped a link into the chat. And so what I'm going to ask folks is for you to open up a new web browser and to copy that link and paste it into a new browser button. Don't jump out of our Zoom because we're still going to hold some dialogue. So copy that link, paste it into a new chat. And what it's going to allow you to do, Alyssa's going to pop it up shortly on the screen for us. It's a collective discussion board. So we're going to answer 3 questions here. And there you go. Thanks, Alyssa, for bringing that up. So these are the 3 questions. In the video, what did you hear that could impact someone's health? If these concerns were raised in your program, what solutions or connections would you have? And what improvements would you expect to see, if any, of these items were to be mitigated through legal supports or intervention of the cases that were discussed in the video? And so the way you use an idea board is you click on the green plus sign and you can add your own sticky note once you pop this into your browser. If you agree with someone's sticky note, so someone put housing that they saw, someone put stress, you can click on that +0 and it will allow you to upvote that idea. So if you want to add a new idea, click the green sticky circle. And if you want to upvote someone that already typed it in, you can then click on that +0 in the bottom left-hand corner. This is just a different interactive way other than using the chat box continuously. So I'm going to be quiet for a few minutes while folks add to this idea boards and read through it. And if folks are having problems accessing the idea boards, you can pop responses into the chat and we can see them there as well. We'll toss up a invisible 2-minute timer, so keep adding to those boards. All right, folks can add their final thoughts. And for those that might not be able to visually see this, sometimes web browsers block idea boards. I'm just going to cover these real quickly and then we'll transition. So what did folks hear in that video that could impact someone's health? Housing, criminal records, loss of a loved one, stress, looming legal issues, education, stigma, child needing additional support services, financial strain, support system, someone to talk to. And as many of us know, anything in that column there could impact someone's health, could impact their future, could impact the health and future of a whole household. It's a big concern. If the concerns were raised in your program currently, what solutions or connections would you have? Someone put social worker, another person put connect to social worker, who could then connect to legal aid, a few steps in that process, and then New Hampshire legal aid. And finally, what improvements would you expect to see if any of these items were to be addressed or mitigated through legal support and intervention? Longer term success rate, lower stress, which would in turn allow individuals to focus on other aspects of life, hope for the future, access to housing, better health, less anxiety, less reliance on emergency services and more independence, easier navigation through the legal system, community partnership with shared goals, safety and basic needs secured, less legal debt, and empowerment of the individual. Thank you. I love ending on that one. Next slide, please. So how does an MLP combat health harming social conditions? So there's sort of 4 categories. Train and educate the healthcare, the public health and legal teams to work collaboratively to identify health harming social conditions that are upstream. Treating individual patients' existing health harming social conditions with legal care, ranging from triage and consultation to legal representation. Transforming clinical practice and institutional policies to better respond to patients' health harming social conditions. And preventing health harming social conditions broadly by detecting patterns and improving policies and regulations that can have impact across a whole population. Next slide. In MLPs, we call this the I help categories. So these are the categories where intervention is typically directed. So income and insurance, housing and energy, education and employment, legal status, and personal family stability. Again, a few statistics for you, that low-income Americans do not get any or enough legal support for 92% of their substantial civil legal problems. And 33% of low-income Americans experience 1+ civil legal need related to the pandemic. Next slide. So how do we provide supports and integration and interventions that address and support health harming legal needs? I'm going to give you another example. This was an example that came from our MLP. We don't have it videoed, but I can walk you through the case. This was a mom who is receiving substance use disorder treatment and has 2 small children. The mom went to her provider, and the provider had concerns because mom missed several appointments, not working, has extreme financial distress, and the child is not in childcare. Upon further discussion, mom is referred to the MLP because it was founded that mom had a past history of a loss of a license, which was restricting childcare access, housing, and employment. Through the partnership and through the engagement of an MLP attorney that was able to investigate the loss of a license charge, have the license reinstated and fines cleared, mom was able to successfully find a higher paying job, not be limited in her housing location due to only being able to formally take remote work. She was able to accept other opportunities. And the child was actually able to start attending child care because they were able to move to a location that had more access to child care. Better understanding the risks of patient populations and communities, providers can prioritize care for the highest risk and identify prevention measures that will keep risks from rising. Having legal professionals work on site together with healthcare professionals addresses and treats the most complex social drivers of health, which often require legal intervention. Some of these items include things like unlawful evictions, unsafe living conditions, lack of income supports, improper denial of public health benefits, safety, and unlawful utility shutoff. Through screening, an MLP attorney may discover that a patient's housing is infested with rodents, for example, which could cause health issues if continued over time without mitigation. The MLP attorney proactively addresses the issue. For example, sending a letter to the landlord or representing the patient in a lawsuit challenging the unlawful housing condition. By resolving the legal issue, a patient's health may be improved. Also, the whole family's health may be improved. Responding to less costs on healthcare, less missed days of school, parents missing less work to care for their child, improved quality of life, more social engagements. Some MLPs are also able to engage in broad-scale policy work, which they consider patterns of social drivers of health in a population, advocate for policy changes that have impact on population-level health. For example,
hi, this is Ruth Bergren. Thank you for your patience.
someone is not on mute. If everyone can check their mute, thanks. For example, MLPs may advocate for stricter housing code regulations or tougher protection for tenants in housing disputes. Next slide. I'm going to dive into a little bit about the MLP that we're currently doing at Dartmouth Health alongside a few community agencies. Altogether, our medical legal partnership is comprised of a project manager, an embedded lawyer through New Hampshire Legal Assistance, an MLP steering committee, and 2 community sites. One is at an integrated substance use disorder treatment center, and one is a family resource center, both located in New Hampshire. Next slide. Some of our MLP milestones are developing a steering committee, formalizing a partnership with NHLA, onboarding 2 community sites, and embedding legal services, development and completion of an 8-part ECHO series where we had 72 registered participants across the community, formalized staff education and case consultation, and develop an integrated health harming legal screening question at one of our site locations. And as you go back to that slide that showed the river and how we train and treat and transform, you can see that we have touched on all of this throughout our milestone timeline. Next slide. We work across teams by improving access and screening to all patients within our MLP. And some of these questions are what we are including in our screening at our site locations. We don't expect lawyers to be doctors and vice versa. However, through various forms of knowledge exchange, such as clinical staff meetings, case consultations, formal education series, and policy advocacy, we can share and interchange knowledge collectively to support various patient-client relationship needs, accounting for patient literacy, rapport building and trust, and satisfaction with connection and follow-up to resources. This last part is a huge satisfier on the behalf of the professional teams, as many of them have told us it just doesn't feel good to screen or ask someone a question when we don't have the resources to provide that family. And now, because of the MLP, we do. Our staff are feeling more supported in asking those social drivers of health questions because they now understand some of the additional connections and resources and supports that they can connect the families to after they ask those questions. These questions were developed across our clinical teams, including families, and there's some of our higher needs that are being sought at both of our site locations. So as you can see, food, housing, safe living conditions, and then benefits for financial security and wealth, which we know also impacts health should there be gaps in all of those. Next slide. Some of our impact data to date. On the left-hand side, you'll see our iHelp categories. Those are the number of cases for each of those different categories that have been supported. And this data is just 9 months of data so far. We also are looking, because we're looking at households and we're looking to be as far upstream as possible, we're looking at the early childhood time period. So we are looking for impact on children in general. And so you can see that 47 children in the household that are under the age of 18 have also been supported through the medical legal partnership. 32 individual support, so that's direct to client. And then staff education hours, it goes back to that train, treat, and transform. And I think it's important to note that hard numbers do not tell the full scope and complexity. that these are multi-generational households, that there is some major financial impact that we won't see for some time. There's long-term impact, and then future policy implications that are also helping drive some of this change. Evaluation is important in all the work that we do to look at ongoing improvement, both in programs and across populations, and really looking at patient and client satisfaction with the work. Evaluation builds the case for ongoing sustainable funding, both internal and external, and really basing on improved health outcomes and cost savings. Next slide. So did MLPs really make a difference? We looked at some hard numbers, but I'm going to show you a little bit of data from sort of across the country and what the research is showing. Dr. James Tufel and Daniel Werner identified that between 2002 and 2006, and then 2007 and 2009, looking at 5 years of baseline and 3-year follow-up data, that the benefit relative to cost increased over that time period, that the number of people served increased, and the number of cases won actually remained the same. They showed social and financial impact, including between the 2007 and 2009 time period, get ready for it, a 319% return on investment of healthcare recovery dollars. So over 300%, including Social Security benefits, family law services, and end-of-life care. This includes 49 Medicaid cases, 55 Social Security benefit cases, and 43 will or power of attorney cases. At their 4-year midpoint of their research, they reported that 11 out of the 12 educational outcomes of the MLP benefits outweighed the costs. Again, that will be cited in the references should you have more questions about that and want to dive deeper into that report. Next slide. So how are we collaborating? Ann Sosen's presentation really talked about partnership across agencies and across healthcare systems and communities. And it really resonated with me because in order to do this work, again, doctors aren't lawyers and lawyers aren't doctors, just like teachers aren't lawyers. We all sort of have our role and our place, and yet we're seeing the same populations, we're seeing the same individuals that come through our doors. So how are we working together? In this work in particular, we create a shared agenda and a common agenda. We have a shared vision for change and a common understanding and process. We also worked on shared measurement. What are the outcomes that we want to see in this work together? What are the data tools and collection and accountability? And how are we going to get there? And what's our performance going to look like? We also collected mutually reinforcing activities. That includes what's reinforcing for the patients and the populations we're serving, and also the providers, and also across our communities. We developed communication plans. That starts with developing trust. And then also, how are we going to communicate across the project? And then we also need a backbone agency as we develop resources and skills to convene and deploy this work further and further as we expand. In conclusion, I would like to say thank you. I'd like to say thank you for teaming up and taking action, both within your programs, across your communities, and across your populations to improve health of individuals, of families, and of populations for the future. Thanks so much, everyone.
Thank you, Holly. That was a great presentation. I want to encourage anyone that has questions to feel free to use the chat to enter those. You can put them in so everybody can see them, or you can put them in just so I can see them. A few questions have come in already. And the first question is if you could talk a little bit more about how to find like what makes it a good legal partner, what should people be looking for? Just elaborate a little bit more about that.
Sure, Becca. So a good legal partner, again, I'm not a lawyer, and so I don't work in the legal world, but every state has civil legal and criminal legal supports and services. And interestingly enough, and they support, the same populations that we're seeing in healthcare, that folks are seeing in the community. And so reaching out to your civil legal supports and finding out sort of what they do, what their actions are, right, what their strategic plan is, what goals they are, and perhaps you have some common goals. How they're impacting and supporting the populations that you're seeing in your programs is a great place to start. And I can tell you with some of the project implementation I've done, we've started fairly low with our uptick of services. And then as we, apply interventions and improvement, we see that number grow. The other piece that I didn't touch on here is that we have also worked with 603 Legal Aid, who supports criminal activity as well. And so we've been able to work with that group to target that population that might have past criminal charges, and they need those annulled, as it showed in the video as well. So sort of some of the different legal supports and services target different populations. The other response that we did is the Upper Valley, where I'm located in Lebanon, is a really unique space because we see families from both sides of the river, Vermont and New Hampshire. And so one of our clinical sites in particular was really talking about what are the supports for their Vermont families. And while we couldn't financially partner with the grant funding that we were under for Vermont Legal Aid, we did certainly pull in their supports and services to our clinical teams so that they could support those patients. A lot of these civil legal community supports serve low-income individuals. That's also really important to note. So as some of our earlier slides showed, that the populations of low-income Americans cannot access legal supports and services because they just can't pay for it, right? And so that's an inequity in itself. And so these organizations are there to really support those populations.
Thank you. A lot of questions come in, so that's great. Could you please give a bit of information on funding or financing of the MLPs, and how does that vary from place to place?
Oh, so interesting. Such a good question. When we were spending time really researching in the early part of our work around MLPs and what they are and how they're funded, that was one of our big questions. And it's kind of done all over the place nationally. So some folks have started with philanthropic dollars, captured the data, done the evaluation, and some of them have actually been able to add it to the operational budget. We are working with our government relations at Dartmouth Health as well as part of our strategic advisory group. And so I think that's a leverage in itself to, many of them are lawyers by trade. They also can advocate on the policy level. So I'd say most organizations have a mix of funding right now. And sustainability is always a question for that as well. There's a great group, MLPB, if you're really interested in this work. It was formerly MLP out of Boston. They've done some really early work and really were some of the grassroots and continue to grow. And they're moving, I would say, more away from individual level impact and more into population level impact, a lot of policy change, et cetera, so that they can target sort of bigger populations and bigger scopes of work. But they're real trailblazers in this work.
Thank you. Does this model include legal consultation? And by that is general and not client-specific advice, as well as client-specific representation?
Yes, great question. I did target that on one of the slides, and that's part of that staff training and consultation that we have been able to create at both site locations. Because, as I mentioned, and I continue to say that, doctors and social service staff are not lawyers. That's not what they were trained to do. There needs to be a lot of education in different forms. And so case consultation is one of those methods. So before someone sort of promises legal intervention to a client, often they want to know, do they qualify? So they'll do sort of a knock on the door. Hey, I have this situation. Is this something that you could support? So there's a lot of consultation that's a little informal. And we also have our legal aid embedded lawyer sitting at a case consultation table at both sites weekly, where they go over, because there's a lot of exchange of knowledge information, de-identified and HIPAA compliant, that can happen when that formalized case consultation is built into the project.
Thank you. When you were talking about some of the outcomes, you shared some statistics or some numbers, and then noted a few of the many complicated factors that would impact the outcomes. And I'm just curious. This is my question. I'm curious if you were to design an evaluation for this program, thinking about some of those complexities, how else would you look at those data, and what would be some considerations for others that are maybe considering starting such a program, kind of a priori, like at the beginning, to start thinking about how to structure their data?
It's such an interesting question, Becca. And I think, that's back to that funding question, is the more data that we can capture, right? The more we're going to see future funding opportunities for this work. I'm really interested in longer term, probably evaluation and more return on investment. I know what I noted was a little bit of return on investment for hospital dollars. I also want to see sort of return on investment for a client or a participant. And that is something that we're going to be looking into as this project goes forward. It just takes a little bit longer to capture because some of that stuff, quote unquote, takes just a little bit longer. So things like Social Security benefits, and when you have that reinstated, capturing those dollars for a person, and does that change where they're able to live? Does that change the type of food that they're able to eat? Those kind of pieces. The other evaluation is a little harder to capture, but there is definitely a piece around trust and trust of legal supports and services. Some of the populations that we're choosing to work with are fairly vulnerable populations, populations that are in substance use treatment, populations that have been impacted or affected by trauma, that have mental health. And so trust is just it takes a little bit longer. For many reasons, and trust with more individuals. So that piece is also really interesting to be looking at and evaluating how long it takes to build trust, what are the best ways, and then what are those outcomes for that person. I'm also really interested in family level evaluation data as well. So as I mentioned, we're really looking at the early childhood time period, knowing that a legal intervention for a parent is actually going to impact a child, right? So there are definitely child legal impacts around education and childcare settings that you can focus on, and like SNAP and TANF benefits. But there's also the financial implication or the housing implication that really circles around the whole family, and measuring that percentage on up when it really impacts more than just one individual.
Yeah, that's what made me think of the question, was seeing, I think you had intergenerational trauma as an example, and then also thinking about the story that was shared about the mom whose child was receiving services, who had autism. And so I was thinking about these other outcomes and how you could really demonstrate such a benefit, like you said, certainly beyond hospitals, but certainly for families and for kids and for healthy development for kids, and what impact that might have, for this child, at least on their learning and their social development as well. So it just seems like there's an incredible amount of opportunity that can come from an early intervention like this with legal support to make sure that the people are getting the services that they need.
Yeah, I think there's also some projection data that can be captured too, Becca, right? The gentleman in the video that talks about the incarceration, and when someone has an incarceration, and, he talked about a 27-page document that was, wiped clean for him. And you could project all the levels of impact that could have on somebody. So there is not a lot of evaluation, I'll be honest, across MLPs. I shared the number of MLPs as of 2019, we're over 300. And there's not that much evaluation. So there's definitely a gap for that in particular.
Yeah, and I can see how the data sharing across different partners would be challenging. Ooh, I'm not muted. Okay. Would be challenging. And then thinking about transparency with people that are receiving the services, making sure that their data, they know that their data are being shared, and do they give permission for that to happen. So I feel like that's a whole nother level of complexity, but it also does seem like being able to do that with their, certainly with their permission and informed consent, but that really could kind of help give a sense of the scope from this type of investment for people's different circumstances on their health and the health of their families. And I think just the last question I have, because I haven't seen any other ones pop in, so feel free. We still have a few minutes if other folks have other questions to put them in there. When I think about our members at Maine Public Health Association and our partners, if someone's in this session and they're really, moved by this presentation, which would be totally fair because you presented a lot of excellent information, what would be a good kind of first step? Like if you had to think back to when this was starting, like what would be a good first step for people to do as they started to explore a program like this at their organization?
That's a great question, Becca. So I would look at interest level. Interest level and gaps. This program in particular, other folks in my leadership team have heard me talk about that. This one was fairly streamlined to implement. And I think because there was such an identified gap in need for this service. So when you see that, it just becomes a bit easier to, folks are really willing to partner. They're really, seeing this as it's not competing with other programs and projects and things, that it is really this big gap in service. So they want it, right? I also would say really taking a look at what population you're trying to improve. And so we had a pretty targeted population that we were focusing on: early childhood, New Hampshire based, low income, and then substance impacted or affected, or in treatment and recovery. And then, yeah, I would say that, and then starting to gather some of your baseline data around, is this already happening? So talking to your legal aid group and saying, where are your referrals coming from? Or who are you currently supporting and who are you partnering with? And that will help sort of direct that gap and limitation area for folks to sort of be thinking about further intervention once you sort of zone in on your target population. And then also becoming kind of breadth in the MLPs nationally, I would say was also a really early first step to really see what MLPs could do. Some are working with incarcerated populations. Some are working with specifically the homeless population. So there's such interesting work happening across MLPs. It's really diverse.